Let's cut through the frustration of overuse injuries like tennis elbow, patellar tendonitis, and Achilles tendinopathy. It's a cycle of pain and misery that can leave both you and your patients feeling stuck. In this video, I'll share practical strategies to help you coach your patients towards recovery. We'll explore ways to break the loop of hurt and suffering and get your patients back on track. So let's dive in and understand the challenge of overuse injuries. Overuse injuries like tennis elbow, patellar tendonitis, and Achilles tendinopathy can be notoriously difficult to manage, like putting those cute little hats on my cat. They persist and recur, and patients seek treatment after treatment. Imagine being stuck in a cycle of pain, rest, and re-injury. It's like being on a merry-go-round that you can't get off. Patients and physios feel discouraged, but sometimes we just need to face the challenge head on, jump in the saddle, and ride towards a solution. So what makes these overuse injuries so complex? Well, it's often a mixture of different factors like biomechanical issues, muscle imbalances, training errors, poor posture, even stress and anxiety. Identifying and addressing the root cause can be a real brain twister. Traditional approaches to treating overuse injuries often fall short, relying solely on passive treatments like massage or heat for temporary relief, but can create a patient dependence and neglect the underlying cause of the injury. Many patients don't fully understand their condition, which can lead to misconceptions and poor self-management. That's why patient education is so powerful. By teaching patients about their condition and how to manage it, we can help them break the cycle of setback and struggle. In busy clinics, the time constraints can be challenged. Physios might not have enough time to provide the comprehensive education and exercise instruction that can exacerbate the problem of inadequate patient engagement. So what's the solution? We need to shift our focus from just chasing the pain relief to empowering patients through active rehabilitation and self-care strategies. By teaching patients to manage their own conditions, we can help them take control of their recovery. Our goal is to move beyond passive treatments and empower patients to take an active role in their recovery. This means teaching patients how to identify and address the factors that influence their pain and how to manage their condition independently. We've explored the challenges of overuse injuries. Now it's time to introduce a simplified approach to tackling these complex cases. Section 1, Physio Made Easy, 3 diagnoses, 3 treatments for overuse injury success. Here's the deal. Managing overuse injuries can be a head scratcher, but I've boiled it down to 3 simple diagnoses and treatments. But wait, I already do a video? Yes, I did. Let me give you an overview so you can put these overuse injuries into context. I'll categorize physio injuries into 3 main diagnostic groups. Overuse. These injuries develop due to repetitive strain, prolonged posture, and overtraining. Think tennis elbow, patellar tendonitis, Achilles tendinopathy, but also rotator cuff tendinopathies, patellofemoral pain syndrome, and shin splints. Traumatic. These injuries result from a specific incident like a fall or a sudden forceful movement. Examples include post-surgical cases, post-fracture patients, and motor vehicle accidents. Systemic. These injuries stem from an underlying medical condition affecting the musculoskeletal system. Think osteoarthritis, rheumatoid arthritis, fibromyalgia. Now let's take a look at my 3 treatment categories. Pain management. We start with reducing pain and inflammation. This might involve relative rest, activity modification, and self-applied pain-relieving modalities. Recovery of motion. This second stage is all about restoring pain-free movement. We might use physio-assisted techniques, active pain-free exercises. This is where heat and stretching can be so super useful. And finally, strength, balance, and mobility treatments. This final stage includes progressive functional exercises. It may involve weaning from an assistive device. It can be specific functional tasks that the patient needs at home or at work. This simplified framework offers several benefits, including simplified clinical decision-making. I've used this approach with thousands of patients, and it works. My simplified approach makes communication clearer and more effective. Research shows that simplicity improves patient understanding and engagement. By ensuring everyone on the healthcare team is on the same page, we can provide better care and coordinated care that's tailored to each patient's specific needs and each patient's specific physio plan. A clear structure for categorizing patients and their treatments, because that's why we're here, to treat patients. This has to be clear. What are you doing? Why are you doing it? It has to be clear to the patient. It has to be clear to your team. It has to be clear to you. So that when you see this patient next week, you won't be scratching your head thinking, what was I thinking? Now that we've got our framework in place, the rubber meets the road in this initial phase of treatment, let's dive into the nitty-gritty of pain management and see how our simplified framework plays out in the real world. Section 2, From Pain to Progress, PT for Recovering from Overuse Injuries. When it comes to treating these overuse injuries, managing pain is a top priority. However, it's essential to understand that pain isn't always a sign of tissue damage. Factors like mental state, past experiences, anxiety, and distress can all play a role. That's why educating patients on the neuroscience of pain is so vital. Sometimes I say things like, pain is an alarm system, not a damage meter, or nerves can be overly sensitive, or movement can help rewire the brain. By understanding how pain works, patients can break free from fear and anxiety and cultivate a deeper trust in their body and move with confidence and ease. While treatments like TENS and laser can provide temporary pain relief, they shouldn't be the main focus. Instead, patients should learn how to self-applied pain relieving techniques like heat and ice that they can do at home to manage their symptoms and reduce their reliance on therapists. Gentle, pain-free movement can also help empower your patients. This includes gentle isometric exercises to stimulate tension in the tissues and promote blood flow, exercises that stay within that patient's pain-free zone to avoid further irritation, gentle exercises above and below the injury to ease stiffness and maintain mobility. Like if you have tennis elbow and you go to the grocery shopping, do some gentle active range of motions for the hand, the forearm, the elbow, the shoulder to warm up before heading out the door. In addition to specific exercises, modifying activities is crucial during this phase. Patients should use the affected limb as much as possible without making their condition worse, like minimizing jumping or lunging when you're struggling with patellar tendon or Achilles tendonitis. Keep up regular walking and daily activities to preserve as much function as reasonable. Be sure to specifically address what's bothering them. Like for tennis elbow, education about trying to use the hand supinated minimizes the use of those ouchie extensor muscles. Or try a patellar tendon or Achilles tendon strap or taping for tendonitis. It's also important to educate patients on the importance of relative rest to reduce the irritation and inflammation, like short-term use of taping or a brace for tennis elbow, patellar tendon, or Achilles tendonitis. By applying localized pressure, these straps or bands help decrease painful tension. Modifying activities to avoid aggravating symptoms and restarting that pain cycle. Prioritizing rest and recovery now. Everyone wants to push, and they wonder why they're going nowhere. Instead, tell your patients it's okay to rest and take it easy. We'll address that stiffness and weakness later. Now, we need to err on the side of rest and immobilization. Sometimes I have to tell patients to take a break from some activity that they really love until they're feeling better. If pickleball is irritating your legs, then maybe you need to take a break for a few weeks. Sometimes we need to push patients more to do more, and in this case, we need them to do less. Rest is best. Heal now with the understanding that the next phase, recovery of motion, and then later we address strength, balance, and mobility. But we need to start with relative rest and healing. Let your patients know that recovery is often a slow and gradual process, so wear your patience pants, my friends. Now that we've got pain management under control, it's time to shift gears and dive deeper into the world of coaching strategies toward active rehab and self-management. Section 3, Coaching for Recovery, a practical guide for the physio of overuse injuries. Now that we've talked about the important initial phase of pain management, we can focus on the next steps, recovering motion and then strength, balance, and mobility. As patients progress through these different phases, adapt your strategies accordingly. During the recovery of motion phase, focus on pain-free exercises to restore motion. Use heat to relax tissues. Some manual therapy may be appropriate here, but like always, home exercises are king. Be sure your patient knows that one most important stretch to improve that one most important motion. For strength, balance, and mobility phase, emphasize exercises that mimic daily activities, fall prevention, and balance, or some important home or work tasks that they need to get back to. To ensure patients get the best results, try these helpful strategies. Simplify pain communication. Use simple traffic light system, red, yellow, green, to help patients describe their pain levels. All this education, and we're playing red light, green light like kids. Patient education is what we do, and like I said before, simpler is better. Clearly explain the purpose of exercises, address their misconception, and emphasize the importance of staying within that pain-free zone. Setting goals together supports patients in learning how to manage their recovery so they can feel more in control. If you've ever been a patient in the healthcare system, you know how it can feel like being on a roller coaster with no idea where the track is taking you. So giving patients a sense of control can sound obvious, but I've met a lot of doctors and physios who still have the attitude of, I'm the expert, so do as I say. And that's garbage treatment. Recovery isn't just about the body, it's about the mind. We must support patients' mental well-being. reduce fear and anxiety by reassuring patients about their condition and their ability to exercise, provide motivational support by helping patients commit to their treatment plan and believe in their ability to recover, help patients stick to their home exercise programs and stay on track. If patients don't buy into your program, even a great physio program, it's going nowhere. That's what this video here was about. As we work with our patients, remember that our ultimate goal is to help them regain confidence and independence in movement and daily activities. To ensure effective treatment, keep the following principles in mind. Keep it simple by focusing on the most important exercises and avoid complex routines. Pain-free exercise and rest. Prioritize exercises that don't aggravate and allow for relative rest. Maintain functional activities. Encourage patients to continue doing what they can for themselves at home. Be flexible as a physio. Adapt to the patient's changing condition and progress through the phases. Congratulations, you made it to the bonus section. But wait, there's more to discover. Now that we've explored the world of coaching strategies, let's just take a step back and look at the big picture and understand how our approach fits into the broader physiotherapy landscape. Bonus section, the big picture physio, putting it all together, the PT 80-20 rule to focus on what really works. Have you ever noticed that some patients get better quickly with basic physiotherapy, while others need more time and effort? This is because patients can be divided into two main groups. This is the 80-20 rule, and this isn't just about the numbers. It's about focusing on what's simple and effective. About 80% of patients respond well to simple physiotherapy techniques and see big improvements in just 4 to 6 weeks. They can move around better and they can do daily tasks easier. What about the other 20%? These patients have more complicated problems like chronic back pain or tennis elbow. Their treatment plans are harder to predict and they might need a team of experts to help. These tough cases can be frustrating for both the patient and the physio. Patients might want quick fixes like massages or heat treatments instead of doing exercises to get stronger and move better. This can make treatment planning unpopular. I know I've lost patients because I can't agree on that treatment plan. Meh. We need to change how we think about physiotherapy. Instead of focusing on the tough cases, let's remember that most patients, about 80%, get better quickly and easily. This shows us that physio really works. Sure, I've met doubters who say physio is a garbage profession, but they've never been to the other side, that 80% where physio really effective. Like the inpatient rehab or nursing home rehab or home care physio, it's usually the outpatient physio, that challenging 20% that most people see. That's where they wonder, what good is this? I've mentioned Physio's branding problem in some of my other videos, so check that out here. While there's no magic wand, there are key principles that drive real physio results. I've seen firsthand the outcomes in my own patients. That's why I'm making these videos, so you can help your patients too. Here are some key principles for effective physio. Active exercises and patient education help focus the patient on functional improvements. Teaching them how to take care of themselves, acknowledge limitations, recognize that some cases are tough to treat, and that a special approach might be needed. Don't promise your patients the moon, but you can promise to try for an improvement. Balance evidence and your experience to create the best treatment plan you can. Again, that's why we're here, eh? Focusing on functional outcomes helps patient achieve goals that are important to them, like meal prep or doing laundry or walking for work. As physios, giving the best care is our top priority. To do this, it's really important to work together with other healthcare professionals when we need to. We can't do it all by ourselves. Teamwork makes the dream work. Another way to provide great care is to use your time wisely. This means asking support staff to help with routine tasks like passive modalities or exercise program supervision. By doing this, you can focus on the really important physio stuff like creating personalized treatment plans or answering patient questions. Now that we've explored the world of physiotherapy, it's time to tie everything together with a bow, and let's distill the key principles for coaching overuse patients and get ready for action. This is my last blue slide here, so let's recap the essential principles for coaching patients with overuse injuries. Effective coaching means moving away from passive treatments that can create dependency and hinder patient empowerment. Instead, we should focus on active rehabilitation to break the cycle of recurring pain. Our goal is to restore function and not just manage symptoms. Educating patients is crucial in empowering them to take control of their recovery. Emphasize the importance of rest. To really understand the importance of active treatments, I have a video that explains why. A simplified approach to diagnosis and treatment makes patient care management more effective. We can categorize these patients into three main types, overuse, traumatic, and systemic. We talked about that. Similarly, the treatments can be organized into three phases: pain management, restoring motion, enhancing strength, balance, and mobility. Our ultimate goal is to empower patients and transform them into active participants in their recovery. We serve as coaches and guide them towards self-management and long-term health. By teaching patients to track and interpret their symptoms, we use clear communication and education and encouragement to foster independence. Now it's your turn. What specific strategies will you implement in your next session with an overuse patient? Share in the comments. My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. Buckle up, because this video is a wild ride. And by subscribing, you'll be part of a community that values growth and knowledge. Thank you.